What makes Rainbow Gardens different than other care facilities? And there is a big difference. You can talk to almost anybody that comes here and they will remark on what a nice place it is, and just it feels good to be here. They'll feel at ease coming into the building, and the staff very much advocate on behalf of the residents. They have high expectations on themselves to provide the best of care, and I think that's where it starts.
And we love you, that's what you want to add?
Yeah. One of the things I really enjoy about Rainbow Gardens is that we are allowed to care for the people here. We're taught you're supposed to look after your patients like they are your family. And at Rainbow Gardens, I really believe we get to do that here. We get to treat them like their family. That looks nice. How long have you been working on that for?
A long time.
Oh yeah?
Yeah.
Excellent.
It all started with a vision of 3 of our elders. Over a cup of tea, they decided that they needed a place to go when they reached the age of not being able to stay at home and take care of themselves anymore. So through their tenacious efforts, fundraising, they were the stepping stones to get us going, and did all the fundraising to build Rainbow Gardens.
Rainbow Gardens is a 30-bed residential care facility in Port Alberni, and we recently added 10 apartments for assisted living. So there's 40 residents or tenants in total.
We have almost an acre of property here, hence the name Rainbow Gardens. We've got a beautiful big piece of property here that is in the middle of Port Alberni, which is an incredible valley. We have the mountains, the rivers, everything here. It's a great place.
It's quiet and peaceful. The people are wonderful. We're just like a family now, and all the people that live here are friends with one another. We do things together.
I've been fortunate. I've been here since day one. Like, I did my volunteer hours here, got hired right out of school here. I worked at other places, but Rainbow Gardens was always, there was just something about Rainbow Gardens. Here we get to work with everyone. I love the one-on-one that we can have with residents. I know that most mornings I'll be the first one that they'll see, and then at night I may be the last one that they see, so I'm tucking them in. Not all of them have family that can come and see them, so we are their family. I bring my children here quite often. My children can brighten up their day, and exposing my children to this environment.
This is my son Ethan, hey?
It's home, and what's nice is it's home to my family too. Like, my kids love coming here.
Amongst First Nations people, and specifically the Nuu-chah-nulth, we place the highest importance on family. And so when we talk about the elderly, they're quite revered in our families. They're the oldest, they've got the most experience, and they're important members to our society, and people care for them. People make sure they're okay, make sure they're comfortable, and that they're treated well. And that's the norm for us in terms of how we look after people. It's a bit sad for families when their loved one can't live at home anymore, and they've just gone beyond the care that's required that they can give at home, and you can really tire out a caregiver if they don't get some help. So that's typically when a person has to come into residential care, and families really struggle with that. But here at Tsawaayuus, we try to make that transition as easy for people as we can. We are often familiar to the families because we're often related to them and we know them from the different communities. So a lot of the new residents will be pleasantly surprised at who they see here, and they will be welcomed. It's a very welcoming place.
When a resident's first admitted here, the nurse consults with a physician regarding the care that's required for that resident. We consult also with activity coordinator, we consult with the occupational therapy, we consult with a dietitian, and the physician is the one that orders any laboratory diagnostics and medications and any other care that the resident may require. The occupational therapists are going to detail residents' stability and their strength, and we design a program to maintain that strength or maybe increase that strength with an activity person that works with that resident.
Hi, I'm Judy Peterson. I'm the activity director here at Rainbow Gardens. I've been here for almost a year, and one of my favorite things about working here is that it's a small facility and it's a family-like environment. We have spiritual services. We have a few different churches that come in. We have Trinity Church, Salvation Army. We have a Catholic service. We also do a lot of exercise programs. We do bowling. We do chair fit, we do bago, which is big on the weekends. That's a fun one. It's very competitive as well. We try to do pet therapy with the dogs, and we bring in cats as well. It's good for the residents to have a sense of home, especially for those residents that miss their pets.
He's a very good boy.
Okay. Yes.
We are proud of our surroundings. This building is maintained to a high standard.
My name's Pat Forsell, and I'm the maintenance worker here at Rainbow Gardens. I do several different things. I work on the computers here. I work on all the equipment, the heating, cooling units, make sure they're working correctly. I do the ordering for the facility. Everything except the kitchen supplies and the pharmacy supplies. So there's always something new, something different. That's a part of the job I like. I've always been a hands-on person, and getting in there and taking things apart and seeing how they work. I'm always improvising, trying to make something with what I have. We're trying to go as green as we can.
All the rooms look out on the garden, some aspect of the garden, so the people really enjoy that.
Well, just look outside the window. Every color in the rainbow is right there. So it's beautiful any time of the year, but this particular time when the leaves are turning the colors that they are, it's a real extra privilege.
I'm Mart. I'm the gardener here. I work here about 5-6 years, and I do all the gardenings here. And we make all our flowers for outside. We make our own baskets, and we do our vegetables. And all the vegetables that we grow goes to the kitchen. And sometimes people pick a little bit. Yeah, so we use a lot of things in our own garden. It's really great.
We want people to eat the foods that they're used to eating, and for First Nations people, luckily we get lots of donations from different tribes for the kinds of foods that they're used to.
We do provide fish. When we have extra, we drop off at Rainbow Gardens. Our citizens have always relied on sea resources, especially our older citizens. It's a way of life for them, and we've always been taught to share our resources if we have extra.
That's medicine for First Nations people. That reminds them of their families, of home. And it's a treat to be able to provide them with food that they're familiar with and that they love.
West Coast Native Healthcare Society, or Tsawaayuus as we call ourselves, we are culturally sensitive to the Nuu-chah-nulth and to all First Nations. That is our mandate. We are a nonprofit society governed by a volunteer board of directors. We have an appointee from the city of Port Alberni. We have an appointee from the regional district. And those are the only other appointees. The other folks come to us from communities. So these are people from our community that are interested in Rainbow Gardens, what we do, and what our philosophy of running this place is.
Okay, so we'll get started. Are there any additions to the agenda?
Just an update.
A board of directors is a governing body, and so what their main job is to look at the big picture and how the organization fits into the community and what role it wants to play. This is one of the best boards that I'm aware of. They're very good at problem solving, planning, setting goals, and they achieve them.
We're entering into Rainbow Gardens, new spa room. So welcome. It's such a pleasure to be a part of such a good working board that actually accomplishes wonderful things for the community like this spa that we're in. My name is Penny Cody and I'm on the board of directors for the Rainbow Gardens as the representative from the regional district, the Alberni Clayoquot Regional District.
I'm Judy Joseph. I've been on the board for 18 years. I've been the secretary treasurer for quite a while. I forgot what year I became secretary treasurer, but I still am.
Judy, do you accept the nomination?
Sure.
Secretary treasurer? Well, that's good news. Thank you very much.
Thank you.
It's very rewarding being on this board because it has a lot of action to it. All things for the residents that live here, making their lives better, and like, what's better than this spa?
Yeah, beautiful spa.
The West Coast Native Healthcare Society that operates Rainbow Gardens or Tsawaayuus in Port Alberni plans to expand to this site. We are absolutely excited about building next to the Pacific Ocean on the West Coast.
It's going to be just as wonderful of a facility as this one is, and be out there for the West Coast residents for their future.
So we want to keep people close to their homes if they need care inside a facility.
There is quite a few West Coast people here, and they probably would be happy to live closer to home.
It's wonderful to know that you have a facility like this in a community that you can come to when you need it.